Hello, thank you for visiting Children's Emergency at KK Women's and Children's Hospital. Your child has been diagnosed with hand, foot and mouth disease. We have put together this video to help you better understand this condition, how to care for your child during recovery, and when to return to CE or see a doctor again if required. Hand-foot-mouth disease is an infection caused by viruses known as enteroviruses. It can occur in children from various age groups and is especially common in preschoolers. It is a clinical diagnosis made based on signs and symptoms. Investigations such as blood tests and virus swabs are not routinely required. Hand-foot-mouth disease is highly infectious and can spread through contact with nasal discharge, saliva, feces, and fluid from blisters. Hence, it is important to practice good hand hygiene while caring for your infected child, especially after handling diapers and before handling food. Your child should also avoid sharing food or playing with other children until he has fully recovered. The disease is usually mild and lasts for 7 to 10 days. Your child will be issued a medical certificate and should not attend childcare for the stated duration. Common symptoms of hand-foot-mouth disease include fever, painful mouth ulcers, red and sore throat, blister-like rashes on hands, feet and buttocks, poor feeding with reduced oral intake. The majority of children with hand-foot-mouth disease recover uneventfully as their immune systems fight off the virus. Rarely, certain rare strains of the virus may cause complications such as inflammation of the brain and heart. It is important to monitor your child for signs of dehydration. This includes lethargy or drowsiness, dry tongue or lips, crying without tears, not passing urine for more than 6 hours, or in infants, less than 5 wet diapers a day, loss of weight. If these symptoms are present at any time during the course of illness, you should bring your child to see a doctor for reassessment. Treatment for hand-foot-mouth disease is largely supportive and symptomatic. The key aspects are fever control and ensuring adequate intake of fluids. Antibiotics are ineffective because hand-foot-mouth disease is a viral and not a bacterial infection. Fever is a sign that the body is fighting the infection. Fever medicines can help to bring down the temperature and help your child feel more comfortable. You can give paracetamol every 4 to 6 hourly and ibuprofen every 8 hourly. Do not worry if your child's fever does not resolve completely with fever medicines. It is expected that fever will fluctuate. Instead, the key is to ensure that your child remains comfortable. Fortunately, fever medicines also double up as painkillers for sore throat. Topical gel can also be applied on oral ulcers to provide a numbing effect. You should encourage your child to take as much oral fluids as possible to remain well hydrated. Your child may not have a good appetite because swallowing may be painful from the throat ulcers. Do not attempt to force feed solids as it may turn feeding into a traumatizing experience. Instead, focus on keeping your child well hydrated by encouraging smaller but more frequent feeds, offering chilled fluids as they may be gentler on the throat, placing sachets of rehydration solution in the freezer and turning them into ice lollies, giving fever medications like paracetamol or ibuprofen for pain relief prior to feeding. Types of fluid you can give, other than oral rehydration solution, include sweet drinks or diluted fruit juice, barley water, coconut water or rice water, and in infants prior to weaning diet, to encourage breast milk. You should seek medical attention if your child develops fever for more than 5 days, dehydration as evidenced by lethargy, dry tongue, poor urine output, weight loss, vomiting, and unable to tolerate oral feeding, weepy or past discharge from blisters, altered behavior or seizures, headache, giddiness, or chest pain, fast heartbeat, and difficulty breathing. In summary, Hand-foot-mouth disease is a self-limiting viral illness. The main treatment is to ensure your child drinks sufficient fluids and remain as comfortable as possible during the illness. We hope that you feel more confident in looking after your child after watching this video. Thank you.